Good evening, everyone. So welcome to this webinar on Get Your Quality Related Research Published. And we have an excellent speaker and a great panel today for this today's webinar. Now, all the speaker and all the panelists have very extensive CVs. And I will try to keep it very short so that we can get along with the webinar for today. So the webinar will be around 45 minutes to 1 hour, which will be, after that we'll follow it up with a half an hour Q&A with the panel members. And please, all of you are requested, if you have any questions, to post it in the QA box or the chat box, and we will take it. We'll see which are the questions we can discuss. So starting with our speaker for today, I welcome Dr. Satish Chandra. Sir is the Director of Medical Research at the Tawam Hospital, Johns Hopkins Medicine International Affiliate. He has a huge list of proven accomplishments in medical research and innovation, clinical trials, clinical audits, research ethics and regulations, and JCI accreditation, health technology incubation, and patient care and quality and safety. And he's worked in multiple hospitals and centers of repute abroad. And he was the original inventor of the human major depressive disorder gene in 1997. He obtained his PhD and MBA from the United States. He's also American board certified in medical quality, medical innovation, and medical informatics. There's a long list of awards which he has received, and including Best Speaker Award and whatnot. And he has published more than 160 papers in reputed medical journals, including the Lancet, Breast, Contemporary Clinical Trials, Lancet, and International Journal of Public Health. He also headed the pandemic research, which was published in the BNG Infectious Diseases 2021. And he's an avid speaker and is an advocate for patient safety and also for clinical trials. Research and training, teaching are his passion. And he's an editor and chief editor and also for several indexed international medical journals. So we welcome Dr. Satish Chandra to today's webinar. And we also have an eminent list of panel members, starting with Dr. G.K. Singh. I'm not sure if sir has joined yet. So Dr. G.K. Singh was the founder director of AIIMS Patna, which is the Institute of Excellence. A brief CV, he did his MBBS and MS Orthopedics from the King George Medical College. He also has a master's degree in clinical epidemiology from the University of Pennsylvania, a DNB in physical medicine and rehabilitation, a postgraduate diploma in hospital management. He has again, a long list of achievements, multiple grants, a lot of teaching experience, and more than 101 publications. And as you know, sir was from the director of AIIMS Patna as the founder director. The next panel member we have is Dr. Chinmay Shah. Sir is the professor and head of the Department of Physiology, GMC Bhavnagar. He also has got a very long CV. He's a GSMC FIMA fellow. And he's the head of the Bhavnagar unit of the International Chair of Bioethics. He's the director IQAC of GMC Bhavnagar. And he's also the editor for the National Journal of Integrated Research in Medicine. He's an external assessor for NABH, NQuas, Kayakalp, and Lakshan. And Dr. Chinmay also has a long list of publications, both national and international, in journals. The third panelist for today, Dr. Praveen Kulkarni, is working as a vice principal and professor in the Department of Community Medicine at JSS Medical College. He's also a FIMA fellow, and he has obtained numerous grants from the Government of India, ICMR, and Bill and Melinda Gates Foundation. He has been award recipient of the Young Scientist Award from the Karnataka Association of Community Health and a Best Reviewer Award from the Association of Physicians of India, Karnataka chapter, a Best Teacher Award. And he's an associate editor of International Journal of Health and Allied Sciences and an editorial member of numerous national and international journals. He was also a principal investigator in the Covishield and Covax trials. And he has, to his credit, more than 120 publications. So I welcome you all, and hopefully we'll have a very fruitful meeting. I welcome all the participants too. So over to you, Dr. Satish, to start off.
Good evening, Dr. Pratish, all the participants, and also the panelists, the esteemed panelists who have taken their time to be here this evening. With no further delay, I would jump and start the presentation. So to all the participants, the panelists, and Dr. Pratish for a very kind introduction. I'm going to straight away jump in. I apologize, I don't know what the issue was to get it started. But like I said, we will be talking about how to basically publish a paper that involves research, healthcare quality research papers. So first and foremost, we'll start addressing what is healthcare quality, followed by healthcare quality research, ideas, what is a citable paper, how do you write the paper, what journal selection, formatting, submission, peer review, revision and rejection, and followed by resubmission. So I am going to give you, use an opportunity to give you a case. Back. So first of all, start with the definition of what is healthcare quality. So what we will be doing here is, I'll start taking you to the year 1980 when Donabedian started defining what is healthcare quality. Basically, in those days, they talked exclusively about it. It's all about the patient welfare and how, as an organization or a hospital, how would you make money and then prevent losses. That was pretty much all about the aspects of quality, although it was initially, that is what the first mover was, Donabedian. 10 years later, a decade later, we had Institute of Medicine. In their definition, they said health services for individuals and populations, where you increase the likelihood of desired health outcomes that are consistent with professional knowledge. So basically, they wanted some sort of an evidence being built into the patient welfare model. So because prior years, as we know, were practicing medicine, that most of the research or most of the quality practices were based on empirical evidence and not necessarily clinical evidence. So that is what they wanted. So there was professional knowledge being incorporated in 1990. Another decade later, the European Commission defined that healthcare should be effective, it should be safe, and it should also take into account the preferences of patients. Because it started accommodating for ethnicity and equity of healthcare. And then the World Health Organization in 2018 provided a broader definition where health should be effective. It should be based on evidence-based healthcare services. It is be safe, prevent harm, and it should be people-centered, where both the benefits and the burdens are shared by the people equally, irrespective of their gender, color, or ethnicity. Now, so this is with this background in place, we will look at the healthcare quality in general, because before we start jumping into research and then publishing and stuff like that. So when we talk about healthcare quality, in the broader realm here, there are two aspects for healthcare quality. One is system performance, the other one is service quality. Now, when we talk about these two, we come across measurables such as safety, effectiveness, which is evidence-based, efficient, which is to reduce wastage, people-centered, where preferences of people are taken into account, values, needs, timely, so that it is provided in a timely manner, both for the provider and for the patient, and it is equitable, so that the care is provided equally to all patients that they receive care. Once this has been taken into account, so any research that is done on these aspects, where it involves, you have a plan, you have a problem on hand, you create a plan based on that problem, you have some methods. After you do the methods, then you have some data, and some data you go back and refine your data. This actually translates into the process of research. So there are two aspects here, both system related measures and service related measures. When we talk about safety, effectiveness, efficiency, people-centered, timely, and equitable, all these are when it's translated into some sort of a problem, a question, and then we try to answer it by applying appropriate methods, get the results, and then evaluate based on our expectations or expected outcomes. And then it becomes health quality research. I just wanted to give you a background before we start jumping in to the writing of the paper as such. Now, let's look at this. This is a research publication life cycle. You see, once we have started the research, we would have our end result would be that we have some outcomes. We would have some research outcomes. This will be followed by, now it's the time to start writing a research paper. So once you have started writing a research paper, you would need a critique who can critique your research paper and share with you the pros and cons of the paper. Then you will have to go to journal selection. You have to somebody has to format the paper depending upon what the journal is. Then it has to be submitted. Following submission, it's peer reviewed. Then it could be a revision or a rejection. You have to work towards resubmission. Then it gets accepted. Once after it gets accepted, then you have a publication. It could be disseminated on social media. Then there's an altimeter which tells you how many reads you had, how many downloads you had, and followed by after a few days of publication, the other people start citing you, and then you have a citation, and then which has been shown as for impact. Combine these two, and you have an I-10 index, H index, and other indices which tells you how impactful your paper was, and the journals have a certain impact. Now, if you ask me who is the most important person writing in this cycle, publication cycle, the person who's writing the research is almost like an all-rounder in cricket. He plays multiple roles, and possibly he also opens the innings for the publication cycle. Somebody who is a critique for the research, or once after the paper is written, somebody critiques them, is also equally important. And I have no hesitation to call this paper as the wicketkeeper behind the stumps, who knows how the ball swings, how the ball turns, and how much is the grass on the ground. And he should be able to page it better. And somebody who the formats of paper is actually very, very critical also in this cascade, because they are like the fast bowlers who actually set the tone for the game to be played. And finally, once after you have done your peer review and you get your revision and rejection, I would call this set of people who work on rejections and revisions. Once there is a decision made by the editorial board, these are the guys I would call them as spinners, because they can spin the content so effectively, so that it gets the revisions are made effectively and it's resubmitted, and following resubmission it gets accepted. So this is exactly what happens in terms of a research publication cycle. Now let's get into when we're about writing a paper. Now, see, the whole purpose of writing a scientific paper is that it will be well read and it will be cited. Because if it is not read and cited, possibly it will not see the light of the day, and you will not be referenced, or you will not be cited, and the paper will be in the dark somewhere with nobody reading or citing it. The whole purpose is to read and cite. Now let's look at just one second here. So the basics of writing a scientific paper. First of all, there are certain tips that I want to share with you when you're writing any paper, any scientific paper, be it a quality research paper. First and foremost, do not expect the reader or the reviewer to be a detective. So apply the age-old principle called as a KISS. Keep it short, simple, and sweet. Don't confuse or complex the reviewer or the reader, because they might be... I'm sorry, can somebody switch off mute their mics, please? So don't expect the reader or the reviewer to be detective. Be very explicit and clear when you present, when you write your paper, make it infectious, infect the mind of the reader like a virus, because that will give you citations, and also make it creative, informative, and inquisitive. Because as Albert Einstein said, creativity is seeing like everyone else sees, but thinking like nobody else has thought. So that is creativity. And as we go further, as we go down this presentation, you will see what I mean by to make it infectious for the reader. If you remember from our memories, we look at the Da Vinci Code, the book that was published in 2003. It has sold 80 million copies by Dan Brown. And I don't have to tell you how infectious the book has been. For all of us who have read this book, or this novel, it has been difficult to put the book down once you started reading. Same was the case with Avatar, the movie that was released in 2009, and the subsequent sequels of it, 29 billion US dollars. It has been very contagious or infectious in the minds of people. And our own movie called Bahubali 2, I'm sure struggling with everybody on our minds, the encounters between Kattappa and Bahubali. So this tells you how infectious or contagious that the content can be, and it stays in the minds of the readers or the movies. So in order to explain and make it a little more easier about how to effectively write a quality research paper, I will be using, I will be taking the help of this study that was published a few years ago in the Armed Force Medical College Journal by Brigadier Chakravarti. It is about a study of assessment of patient safety climate in tertiary care hospitals. Now, I particularly chose this topic primarily because many of my colleagues, physicians in the hospital, do find it very difficult to write a paper on anything other than clinical. A case report is easy for them. It is very easy to write a paper on a clinical trial. Very easy to write a paper on an intervention study or an observational study. But it's very difficult to write papers that have predominantly a quality spin to it. So, for the sake of, I presume that concern lies everywhere, and the issue is almost global. So that's what I picked this paper for. So the first and foremost, the gospel is, if you are going to write a paper, then you will have to follow this method called the IMRAD method. The IMRAD stands for Introduction, Methods, Results, Analysis, and Discussion. It is believed that this was first. The IMRAD term was first coined in the Louis Pasteur lab in Paris many years ago. And since then, this has been the standard or the standard operating procedures for all those who write scientific or quality papers. Now, I'm going to share some easy ways to remember and resolve the challenges of writing an introduction. So first, we'll think about in the IMRAD, first is the introduction. So let's look at how do we effectively write in the introduction. It might sound a little vague, but I am going to propose to you to remember this acronym called as BURP, which should not be so difficult. Okay. First of all, if you remember BURP to write an introduction, you will start by writing the background, which is B. B is background. U stands for unresolved issues or challenges, which are very topical. And C stands for related research, and P stands for the purpose. Okay. So basically, when you start writing the background, you will start looking for literature search. You will search what others have done. Where are the gaps in the practice or in the policies? And you start looking at the literature for gaps in practices and policies. And once after you have narrowed down, and you will also find out what other studies have been done by other researchers, either that supports your hypothesis or your claim, or sometimes it does refute what you have trying to propose. And finally, the purpose of the study is intended to address the aim and the importance and the impact of the problem that you have on hand. So basically, once you have a problem at hand, you will look at the background where the literature search would help you, followed by an unresolved issue, which is very topical. So that is the gaps in practice or in policies, and related research, should tell you what similar studies has been done or asimilar studies has been done prior, and the purpose should take care of your aim and importance or the impact. So BURP stands for background, unresolved issues, or challenges, related research, and purpose. Once you have this fixed in your mind, it is very easy to write an introduction for a paper. Now let's see whether that is true. Okay. Now this is the paper that I was talking to you earlier about from the Armed Forces Medical College. You will find here, with coincidentally that when they wrote the introduction, they have applied the BURP acronyms. First, they talk about the hospitals that provide care. They say it's a very complex environment and decisions have to be made quickly, and that it is a very conserved. We have conserved resources, and there is people fatigue. There are so many deaths that happen because of poor patient safety practices. About 98,000 deaths. Then they talk about the whole concept of safety, and from there, the unresolved issue that they're talking about is very few research or publication exist on this vital issue of patient safety or safety culture in India. So basically, there are reports from other parts of the world, but from India, we do have very little information, and which is from their search or from when they reviewed the global database and looked for research in India about patient safety. So remember here, they looked at they developed an introduction based on the B, which is the background. They looked at the hospitals, the deaths, the safety issue, and then they came with the unresolved issue, which is like where India has fewer publications and have done little research in terms of patient safety based on the database. And then they started looking at related research where they talk about what is the patient safety climate, what is the difficulty in measuring, why is that there have been issues in the past, and also how can you improve patient safety? All these publications from the past that is available were taken into account by them. Then they finally, after BURP is the purpose of the paper. They in their introduction they have written the present paper aims to explore composite patient safety climate, followed by further inquiry into various dimensions of patient safety climate in 3 multi-specialty hospitals in multiple in the metropolis of India. Now, if you look at, see, this paper was published many years before. I coined this acronym called as BURP. But if you look at this, specifically fits in very much into how you write an introduction. So remember with the acronym called BURP. With BURP, you should be able to write down your introduction very effectively because it means background, unresolved issues or challenges, related research, and finally the aim or the purpose of your study. Now, if you have any questions, please do not hesitate to put it on the chat box so that I'll try to sneak in and look at some of your questions. This is followed by a couple of broader suggestions. When you write your introduction, make sure you start off from a broader platform. Whatever information, whatever literature you've collected is very broad, then you tend to narrow it down very specifically to the problem of to the problem that you have on hand. So don't start from narrow and then try to broaden, because that you will lose focus if you try to write your introduction in that manner. So, and there is also another session which is called as the sandbag effect. What generally people do is, like, if I'm writing a paper and I want my paper to be accepted. So what I do is I starting from Donabedian all the way up to the Institute of Medicine and also WHO Health Organization, I try to cite and quote everybody, especially the bigwigs, because in the introduction, so that, it's very pleasing for everybody to see their names or their publications being as a part of references of any study. It gives you a good feeling. But you have to remember, if you do that, and if you start adding all these papers and things that are not very broad, and you do not narrow it down to your question on hand or your problem at hand, then it creates a sandbag effect between you and the reader, and you might lose readership and the paper might not be cited. And it could also be a put off for the reviewers. So please be aware of the sandbag effect. You don't want too much of a too fat an introduction. Introduction should be very limited to the burp, which is the background, the issue on hand, or the unresolved issue, and the related research, and finally the purpose of your study. So if you have any questions, please do not hesitate to stop me or ask me questions. Now, when we write the methods, is another tricky part of writing a paper, because the question is, should you write the methods first or the introduction? It works both ways. I have done it both ways, and I don't find any issues, writing the paper by starting a methods or by starting an introduction. Ideally, I have, in many cases, I think majority of times, I've started to write the introduction, the methods first, because there could be resources that you need. You start thinking of when you're writing the introduction, writing the methods. So, one of the acronyms that I use here for writing the introduction for the methods is called the SPICOT and EAR. Okay, and SPICOT, I'll tell you what it stands for. See, the first S stands for the study site. Where was the study conducted? What hospital, tertiary care center, primary care? It was as an academic medical center. So we would like the reviewer and the readers would like to know where the study was conducted, because if they want to reproduce the study, they want to recreate the study, then they would be looking for something very similar. The second S stands for the study settings and the design. Study settings is what departments, what the study was, the study, how many departments are involved, and did the study, was the study an observational study or an interventional study, case mix, or it was a crossover study? What was the study? That stands for the second S. Then comes the P, which is the patient. It could be the population. Is it studied on? Is it on the population, systems, processes, survey tool? What is it about? So what that stands for, the P. The P stands for whom was it studied on? Was the population, the systems, the processes, or the survey tool? And then comes the intervention. In intervention, what did you do? How did you come up with your study? Did you observe? Was there an exposure? What was the control? All this you will be writing in your methods. And then the outcomes expected, because when you're writing the methods, you still do not have outcomes, but you have anticipated outcomes. So what was the measures they used? What were the potential outcomes? These are things you will be writing in your methods when you start looking at the outcomes expected. And finally, the time frame, from what period to what period will be your study duration. What was the study duration? What was the phase of the study? Like, as a clinical trial, there will be multiple phases. If you're doing a patient safety, then you need to mention when was the study started, when did you get ethics approval, and what is the ethics approval number, and blah, 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 things like that, if it becomes applicable. So SPICOT stands for the study site, the study setting, and the study design, the patient or the population, the intervention that you use, outcomes expected, and time. So my suggestion is, please remember this acronym, and I have something for you guys to remember, which I share with you towards the end. So once you have this, look at how beautifully this paper is constructed using the SPICOT method, the acronym. See, first of all, the first S, they say this was studied at large tertiary care hospitals. In the setting, they say the clinical area being recognized as the areas of interest. All three hospitals are similar in their role capacity, bed complement, and staff mix, and considered suitable for the study. So that takes care of the first two S's. Then they looked at the P here. The respondents were divided among various categories: healthcare workers, postgraduate residents, nurses, and other people. And many of them were being females, and male, and healthcare workers. Look at how beautifully that they have addressed the P, or the population part of it. And then comes the I part, which is the intervention. What was the instrument? What was the study instrument? What was the questionnaire? They used SAQ questionnaire. It's an ambulatory version, and it is a 46-item questionnaire. It takes about 50 to 20 minutes for completion, which is the T part. And each of the 46 items is answered on a 5-point Likert scale. Look at how beautifully all this has been answered. So once, if you remember this acronym, SSPICOT, then it will be very easy for you to write the methods. Now, Is it essential that you always have to come up with a time frame? Because there are many of the participants in previous lectures have asked me, is it important to have the T component in the spigot? My answer is yes, because it becomes handy for a reviewer who's reviewing a paper to know within what time frame the study was conducted. Because if you're looking at patient safety and patient quality or care quality studies, there are some studies that are the data is very seasonal. You don't want those to be a concern for the reviewer and for the readers later on. So it is better to specify the time frame during which the study was conducted. So SSPICOT is the acronym to write the methods. Now let's look at what do you mean by year, which is the extension of the methods. You need to have ethics, analysis, and regulations. So when you talk about ethics, so the study has to be done for the greater good. It has to be, if it is for clinical studies, then there is the good clinical practice guidelines you need to follow, where you have at every point, you have to make sure the participant privacy and the data confidentiality is addressed to, because nowadays the journals are very firm on the fact that even if it is a survey or a questionnaire-based study, they don't want the responses should be accumulated, and you cannot be identifying the respondent individually, because that violates the principles of privacy and data confidentiality. And when you do statistics, always work or think about the sample size that you need to write in your methods, and also selection biases and things like that, whichever becomes relevant to be included in your methods. And regulations, it could be ethics regulations, it could be guidelines. There are, if you are an observational study, then you follow the strobe guideline, equator, clinical practice guidelines, and also there are other the ACRD and the regulatory guidelines. So there are many guidelines also that you might have to follow in case your institution or the journal requires you to follow those guidelines. So remember, SPICOT, SSPICOT, SPICOT, and EAR, are two acronyms that you will remember if you have to write your methods effectively. Now let's look at their paper, when the paper that which we are using as a case here. They have talked about the ethics, and then they have also talked about what was the study they did at ANOVA, and they also did a composite score and a Mann-Whitney U-test also. For testing multidimensional variability among different category of healthcare workers' responses. So they have addressed the analysis, and also if there's any regulatory, they have mentioned about some regulations that they had to follow during the course of the study. So if you use SSPICOT and EAR, the chances that you will miss out anything in your methods is very unlikely. Now, this is the most interesting part of writing a paper, the results part. Now, the results part becomes very interesting because now there are multiple ways to write the results. And more often, you write results in such a way that becomes very confusing. There are multiple thoughts, multiple ideas, put it into a paragraph, and it both throws off both the reviewer and the readers. And that is why you will find, although the authors, these papers are from very established patient safety and healthcare quality professionals, but they do not get the impact, or they don't get the citations that is required because there is no structure to the results. What I would humbly suggest to you guys is to please follow this structure called the parts. And the P stands for the process. How are you going to do it? A stands for assurance. What are the guarantees that you have? R stands for the responses. What are you expected? What are the responses? What was the outcomes? And T stands for the tabulation part of it. How will it all be presented? And S stands for the sideliners, or what you need to be careful when you observe something. So let's look at if it is a survey being administered, as in this case, you will look for the questionnaire. And if it is a questionnaire, then you will check whether there are domains, because you could have domains. It could be a demographic domain. you could have in a patient survey, you could also have a departmental domain. You could have several domains, for example, an awareness domain, a knowledge domain, an attitude domain, and a practice domain. So you should be very careful to initially assess, and you should be able to write your results based on these in this format. And the number of items on the questionnaire, there are some studies where you do not use the entire standardized questionnaire, but you use only a part of it, which is called an abbreviated questionnaire. Use an abbreviated questionnaire, and then basically you explain why you use an abbreviated questionnaire in your process, or the P part of it. How many participants participated in the study, and what was the demographics of the participants, and is there anything unique about the responders? You need to write that in your results. And finally, when you're talking about that, you'll talk about that how much time it took you for them to complete the survey, and how easy was you to navigate through the survey. These are things that you would write in your results. Once after you've done this part, then you will look for whether you will start explaining whether the tool was standardized, whether the survey instrument was standardized. Because every survey that's been validated internationally, it is mandatory that we standardize, or we customize it to our local setting, our local need. In order to do that, it has to meet the requirements for validation, and which is the context and phase validity. It has to meet it has to have a reliability factor, and we have to have standardized collection methods, which is very interesting. And also you need to be mentioning in your results how was the data stored, and how is it protected from misuse or reuse without permission. Now, when we talk about the surveys or questionnaire-based studies, what was the response rate? And I'll come to that in the next slide. What is the effect size? That needs to be mentioned very clearly. Was there any observed differences between the intergroup differences? Like, for example, between male and female, was there any differences in your study? Intragroup, within the group, if you had, between, let's say, between physicians of multiple specialties, then physicians of a particular specialty, within a specialty, did you have any differences between them? Maybe because of their age, or because of their levels of training. All this need to be, and their awareness of patient safety. These should be very clearly stated in your results. And any association, correlation, ANOVA, analysis of variance, and what are the comparators and controls also need to be mentioned. Now, when it come to tabulation, this is more often you will see in publications, this is the weakest link, because people, when they write the results, they write too much details. The descriptive data is not presented as a table, because in most cases, all descriptive data, which is frequencies or demographics, you can create a table. Inferential data, which is the outcomes data, it could be an association, an odds ratio, relative risk, or a correlation data that could be presented as a graph or a table or a figure. And you also need to know that the data tables can be presented either as 2D, two-dimensionally, which is a dose effect curve, as we call it, or 3D, where you have dose effect and time included in the curve. So basically, you need to make sure the data is presented as clearly, and it could be self-explanatory. And in the sidelines, which is what I would draw attention to, there could be factors that are unknown. Could be results that are unknown. You have to be very clear in saying that, very honest in saying that these findings are unknown. If there are outliers, you need to mention their outliers. For example, you did a survey, and there were 70 participants. 6 of them did not write their gender, but the others did. Then you need to write 6 of them. 6 participants were excluded from the analysis of gender variances, because they did not answer these questions. And what are the variances? And if there are any errors in if you anticipate any errors, for example, there are different kinds of errors, alpha or beta errors, you should be mentioning that also as a part of your results. Now let's look at, when you talk about these results, which I told about validity, reliability, response rate, effect size. Now, what it all means? It means, see, validity refers to that if you are measuring something, how correctly it is supposed to measure, or are you using the right tool? For example, let's look at a stadiometer to measure patient's height during a triage. Now, if you are using something else like a foot ruler, you might not be able to measure it. The foot ruler is only 1 foot, and you cannot be measuring the patient's. It is not practically feasible to measure the patient's height and using a foot ruler. So validity is about whether whatever you are measuring is measuring it. You're using the right tool to measure it, and the other example is if you're using a weigh scale to assess the patient's weight, then you should be it's in kilograms or pounds and not anything else. And one of the measures to measure validity is always the KMO values. I apologize here. This should be on the other side. The KMO values, which is the Kaiser, Meyer, Olkin factor reduction values, is what you would use to look at the consistency of the variables. And now the other thing is about reliability. Like I said, if a patient comes to the triage, then you should be using a stadiometer to measure his height. Now, what about if you are using the same, can you reliably measure his height every single time? For example, if the patient is 6 feet 1 inches, every time you measure him, he is 6.1 inches. So if it is measuring it accurately during repeated exposures or repeated measurements, then you know that your tool is reliable. Okay, so the validity and reliability is very important when you're using a survey-based questionnaire. And what is a response rate? The response rate refers to there are 100 surveys being sent out for respondents to complete the survey. 78 of them returned it. So the response would be 78%. Although you would expect, in your initial plan, you had minimum 75% response rate required to come up with a meaningful outcomes analysis. Now, what is effect size? This is often missed by many of the researchers. In effect size, you need to make sure that there is enough power generated for a reliable measure. So you need a minimum sample size. Now, if there are 100 surveys being sent out and 65 of them have returned, but you remember you need about 75, then what you would do is anticipate the loss of 35 for the survey and add 100 and add 35 more to the 100. So you would send about 135 and you have to expect about 75% to return the surveys, which would lead you to a reliable measure, a very reliable measure. So I wanted to explain to you and run through this because often when we write the results, these are the terminologies that are forgotten or missed out, which actually kills kills the interest of the reviewer because they cannot correlate, and they tend to either give you a the revisions could be very intense or major, or they could even reject the paper. Now, let's look at the paper here. Now, how they present the data, they had for all their demographics, they had a table in terms of comparison of 6 scale parameters for the study hospitals, different hospital, different thing, and they had the scores here. And in the sideliner, they mentioned about one redeeming finding of the study was consistent high scores for all the 4 groups of healthcare providers in terms of job satisfaction. Now, this is how you need to write your results. Because if it is basically there's a punchline there based on what they have shown in the tables. And also the fact assessing safety climate through SAQ offers a powerful feedback tool to generate a staff interest. So these things actually generate a lot of interest in the minds of the reviewer and the readers and should not be forgotten. So my suggestion would be if you adopt the PARTS, PARTS, this should be very easy for you to systematically and structurally write a result section of the paper. Now, how would you present your figures and tables? If you will not, I have given you examples, you don't want to present your data something like this, your figure like this, because then it becomes impossible for the reviewer to figure out how it would all look like. Neither you want a table to look something like this. So it should be clear, concise, and compact, visually very appealing. And it should talk from the data, representative of the data, and you should have very explicit legends. Please do not use abbreviations when you are creating legends. For example, if it is a alcohol neuropathy, don't write AN and leave it for the reviewer to figure out what it's all about. So explicitly write down all the details in the legends for the either for the figure and for the table, and do not use abbreviations. Now, discussion is the important part, also the paper, because it basically it's like the proof of the pudding. So how would you write it is a very intelligent discussion. And the tips here are you remember the term the acronym called PINS. It stands for patterns, interest or interesting, novel or novelty, and strengths and limitations. So first of all, in patterns, you will write about the institution. The study was done as a tertiary care center or a multiple institutions. What was the similarity that you observed between other studies and your study? What was the similarities or differences between your participants and others that you observed them, and the results that was discussed in their papers? And how have you compared the similarity or the differences between your study and other related papers? And if there is something that is unique in your unique pattern that you see in your study, you need to mention that in the patterns part of the discussion. Now, does your study become very interesting? Because you found some unique correlations or unique association, or the others have reported the risk ratio was a certain, and here you find the risk ratio was much higher, or the relative risk was higher, or the odds ratio was different from others have reported, or similar, it doesn't matter. And whether you have been able to create a composite score, taking multiple scores into account, such as the risk factor and the correlation together, and to create a composite score. And if it is a scatter plot, then you are looking at a distribution score. If somebody has already published a distribution score and they had a certain distribution pattern, whether you had a higher or a lower pattern makes your study very interesting. How does your study become novel? Because there is an agreement with other publications and is very similar, or is it different? And if it is different, then what was the observation that was different? If it is disagreement, dissimilar observations, you will have to justify what was it, and how have you proven multiple ways that this is different. And if you have any findings, for example, in the previous example, they talked about how using the SAQ was very important and interesting for the participants, and how the job satisfaction, irrespective of the hospitals, multiple hospitals, and also the participants, how job satisfaction scores were very high for all of them. So this is what we call as your observations are amplified. You can amplify them, or in certain case, if it doesn't fit with the overall pattern that has already been published, then you could have your discussions that are muted. But either ways, if it is something groundbreaking, then you have to explain forcefully how did you find this and why is it important. Now, the strength and limitations, when you write the paper, if it is single center, then you have certain limitations, because the study could be generalized to a larger cause or larger population. If it is a large population with a small population, then there is a generalization becomes an issue. Is the public and the private institutions, if you did it in the public institution versus the private institution, public institutions generally tend to have larger number of patients or processes or systems or departments, and that could work in your favor. And whether the study was a multi-specialty or a monospecialty or a unique specialty, whether the hospital was referral or a non-referral hospital, all these become strengths or limitations, because whether it's a large hospital or a public hospital or a multi-center or a multi-specialty, all this brings about complexity. So if you have done this study, then it adds more value and rigor and depth to your scientific investigations, and it adds value to the paper. Now let's look at in the discussions of what they did was they use the P again here, which is the pattern. They say it's a climate. The three tertiary care hospitals located in different regions also share the same attitudes and behavioral norms. And interesting was that it was interesting to analyze the variations in composite PSC index among various categories. So they mentioned about the interesting part. Then what was novel is postgraduate residents and nurses do not demonstrate high perception about managerial intent towards well-being and safety of patients when compared to clinicians. This is an area of concern, such as negative perception may actually indicate managerial deficiencies and affects staff morale, and thus needs to be considered for immediate and sustained improvement efforts. So look at how the pins, doesn't matter, what the paper is, when it was published, or who published it, or what country published. If you apply the pins, you can directly apply, you can effectively write the discussion part of it. And the S part is the strength and limitations. Because this is a single center study, the limitations would be it's a single center study. I'm sorry, this is a multi-center study. The strength would be that it's a multi-center study and not a single center study, and multiple specialties, multiple categories of healthcare providers were surveyed for the patient safety or patient climate safety climate assessment. So this becomes the strength of the study. And after you have written the paper, now we have done the introduction, the methods, the results, and the discussion. You have to start looking at references. Now, references are critical. You should have done your literature search. It should be updated. It could be books, chapters, journals, and web pages. The American Psychiatric Association method is the more common way to reference the format, and list all previous studies updated. So don't, there are publications that I've seen in my career where people forget to list references or cite the recent, particularly in the last 2 to 3 months. And some reviewers go back and check these references, and you need to make sure that this is updated. Now, this is an example of certain web pages. So if it is a web page, then you will have to write when it was accessed, say last accessed on blah, blah, blah. And this is the web page, and most journals now, which is the American Psychiatric Association, which has been followed by many journals now. You list the authors first. This is followed by the title of the paper, the journal name, and the year of publication, the volume, and the number of pages, or page one, the start to the end page of the article. And they expect you to have a digital object identifier number also along with it as a part of your references. Because nowadays, being many of the publications are online, they come online prior to the print publication. So a DOI always helps to track the publication. Now, after you have done all your references, this is the time you start thinking about writing the abstract. The abstracts have to be limited to 250 words. Very important. You cannot write a lengthy abstract as big as your paper. So there, I would use the SMART acronym. SMART stands for the significance of the study. In this case, is patient safety climate among providers. And the methods are survey-based and observational. Analysis that you would use is a descriptive statistics and regression, and in ANOVA in this case. And results is demographics, correlation data, and composite score, and how it all panned out. And finally, will have takeaway and conclusions. So S stands for significance, M stands for methods briefly, A stands for analysis that you have done in your study, and results, what was the major or the highlight of the results, and the takeaway and conclusions. This is what would help you to write an abstract. And I always, I was always been a fan of Michael Jordan, and I liked his slam dunker when he was at the peak of his career. So I have particularly seen among Asian countries, particularly in India, we tend to be very mellow on soft of our findings and not be a slam dunk. So if the observations are good, if it is challenging, if it is novel, don't hesitate and be bold to say that very clearly and loud. Now comes the research of the paper. The question is, it comes to the title of the paper. And I have always fascinated when I was still a student back in Minnesota. I had no idea, because after medical school, they don't teach you how to write a paper anyways or do research. So when I was thrown into this cesspool of doing research, I was into ethics. And years later, although I did my research and then I did my MBA, during that time, I had an opportunity to meet Quentin Tarantino, a movie director from Bollywood. And when he was shooting for his movie called Pulp Fiction back in the US then. So, and then something that he told me is very fascinating. He told me, the title of his movies are generally like The Big Fat Indian Wedding. Now, what do you essentially mean by the big fat Indian wedding? It means There is abundant planning, exorbitant costs, huge decor, classy outfits, too many guests, abundant celebrations. They make it memorable, and there are giveaways. This is what he told me are the essence of an Indian big fat Indian wedding. Now let's apply that like the same principle to creating a title, because Quentin told me like they do not, he doesn't title the movie. It's only after the major portion of the movie are shot that he titles his movies. And no wonder they have been so blockbusters. So let's, for our paper, if you look at, we have, when we create a title, there has to be abundant planning. It has to be concise and not very wordy. It has to clearly state the purpose, which actually stands for the decor. The outfit is the significance, and the guests are the clarity, how clearly how things will be done. The celebrations happen to be infectious, where people remember what the title, and it has to be memorable. If the wedding has to be memorable, then in this case, the title has to be thought-provoking, and giveaways is when you also create a running title. Let me see if yeah. So this is how you would create a title. Basically, there be abundant planning, concise, the purpose, significance, clarity, make it infectious, thought-provoking, and you need to have a running title. Okay, so what do you mean by a running title? Say, I have explained this here in this thing. The paper that we discussed as a case was, the title was a study of assessment of patient safety climate in tertiary care hospitals. Now, this was the publication that we discussed so far. Let's apply the principle of the big fat Indian wedding and look and change the title to assessing survey-based patient safety climate among care providers in multiple hospitals of India. Don't you think this is more interesting, more catching, more thought-provoking, and it will help you to stay in your minds? And the running title would be patient safety in multiple Indian hospitals. This will help you to remember and go back to your references if you need. And I am sure that you will not forget to cite this paper also. How do you write acknowledgements and author contributions? If in the cartoon you see, I'm not interested in that paper you talked about, Dr. Jones, I just want you to put me as an author. You only recognize those papers, people who have actually discussed, planned, read, edit, whatever, funded the project, and support with the conflicts of interest statement. Refuse political authorship, ghost authorship, and friends and family authorship plan. Don't be on it. And how to choose the right topic, right journal. First of all, you need to know whether the journal is broad or focused scope. You need the scope of the journal. Read the scope of the journal, whether it's a multi-specialty or a unique specialty. What are the type of articles? Case reports, trials, opinion, perspectives, letters, original research. You need to know where your article, where your research fits in. How frequent is the publication, whether it's weekly, monthly, or bi-monthly. If it is monthly, it is good, but if it is bi-yearly, it becomes very difficult because you have only 2 chances, and they might take about a sweet time to make a decision on your paper, up to 3 to 4 months, and you would lose time. Track record, how many years of publication also helps in the decision making. And if it is cited, if they have a citation and their impact score. It could be PubMed Central, PubMed, Scopus, or Medline. And if it is any impact score of more than 1.5 in the Q1 quartile would always be very, very good to have published. Now, after you have submitted the paper to the appropriate journal and you have done the peer review process, they send it to multiple reviewers, and the reviewers then have a suggestion whether they expect you to revise. Once after you get the comments from all the reviewers, it's been collated by the editorial team and sent to the editor-in-chief. The editor-in-chief reviews them again and decides whether the revisions, whether the comments are significant enough to warrant a publication acceptance, or it is critical enough to reject the paper. If it is a revision, then as this cartoon shows, it's not easy. You have drafts and drafts and drafts. And initially, I told you the guy who revises the paper, who works on the revision of the paper, is actually like a spin bowler. You should be able to spin you should be able to manage the spin of the reviewers. and be able to play it effectively so that your responses are appropriate. And you should also be responding point by point answers to the questions that and the comments that the reviewers have raised. And this is a cartoon about acceptance or rejection. He says, if you're lucky enough, the journal will send you, the editor-in-chief will write you a note. Dear contributor, thank you for submitting your paper to our journal. To save time, we are enclosing 2 rejection slips, one for this paper and one for the one you are planning to send us in the future. And after it's all said and done, once your paper is accepted, it will be on social media nowadays, Facebook, Publons, on Instagram, WhatsApp. There are so many portals now for dissemination, on YouTube also sometimes. And it is all worth it. Although you will feel that this is the guy who wants to publish the paper, and then he has to go to somebody beats him with the baseball stick, baseball bat, with a sword, with a knife, and ultimately this all gets through. This is the publication process, and finally the paper gets accepted. When it gets accepted, remember, it was all worth it, because after the paper gets accepted, people know you by your first name, and you become known in your community. And after a few publications, few book chapters, you also become an expert. You also become an expert, a content expert, and you share your expertise with our other peers. So now the question that I've always been asked when I do this presentation, is that how do I remember these terms, burp and different things? Now, although it is not not a smart thing to do, but I'm going to share it anyways. I apologize if this is hurtful to anybody, but the way you can remember is SMART. Like I told you, you need to apply the SMART acronym for the for the abstract, which is the significance, the methods, the analysis, and the take-home message and the results. That's a SMART. So smartly you burp. Okay, and burp is where you have the background, you have the unresolved issues and the related research and the purpose of the study. That becomes an introduction. So it's a smartly burp from this spigot drink. So SS stands for the site, the settings, the patient or the population, the intervention, the comparator, how do you compare, the anticipated outcomes, and the time frame. That becomes your methods. So smartly burp from the spigot drink, puke in parts. So when you remember, think about parts, this is the pattern and the assurance, and I forget the parts, and and finally being the limitations, and the strength and limitations of a study, and the pins which you would use for your discussion, until pins and needles. So this is smartly burp from your spigot drink, puke in parts, until pins and needles. That's why, if you remember this, you should be able to effectively write a paper, starting from your abstract to introduction to methods to discussion, and to results and discussion. And by the way, after you drink and you puke, pins and needles is also called as alcohol necrosis, by the way. All that on that note, I thank you all for your attention. I'll be happy to take some questions, and these are my contact details, and I should be able to put it up on the screen later. Thank you very much. I'm sorry if it took a little bit longer.
So thank you, Dr. Satish. That was an excellent, very comprehensive talk on how to get the research published, specifically which is related to quality. So before we take the questions, a brief note to all the participants. I was just looking at some of the questions here. So we have to be very clear that this webinar is on actually writing up your research and then getting it published. Many of the questions are about planning the research and doing the research, and it is not in the purview of this webinar. That's a totally different point altogether. So we would be publishing if hopefully many of you have attended the masterclass series in our research methodology. If those who haven't, we will be making it available for you on our Kaho website soon in some time, and you can log into it and access those videos where we cover the rest of the points. So we are going to stick to the points which are relating to the publishing research article and from your study, how to write up a research article. So before we get to the questions, we have two of our panelists with us, Dr. Chinmay and Dr. Praveen. And because we are short of time, we may have about 15-20 minutes for the rest of the discussion. So if a couple of minutes each, if Dr. Chinmay and Dr. Praveen, you could put on the further points if you were to add on to what Dr. Satish has said. So Dr. Chinmay, so basically these are for most of our participants are budding researchers. They are working in hospitals and they want to get started in quality related research. And so in these early stages, how to go about it, what would be your suggestions to them? And then certain pertinent questions from the Q&A and the chat box we will take up. So Dr. Chinmay.
Yeah, good evening. First of all, let me thank Satish sir. Sir, though since 20 years we are in this field, but your presentation is as always given a new insight to everyone including us. I think Praveen sir will also agree with me that there are some examples which you have given are definitely mesmerizing, and participants are definitely benefited from your presentation.
Thank you, sir.
So I think uh, uh, the way sir has taken, nothing much to add to it. But there are few questions which I was also looking at it. That see how much excellent you write, but before that your study design. As Dr. Paramdes has said that you have to uh, go through the master class, or you first need to have a excellent design. Otherwise, you will write and you will submit to any of the good journal. You have written excellently. You follow all the instructions, but your
Yeah.
study design is inappropriate. Means if I say that I want to teach somebody swimming, and I will ask him that read this book and you will learn the swimming. Similarly, if you will ask me, you are submitting an excellent paper with all the required detail. As sir has given an example of our Indian wedding, you do all the things, but the design is not proper. It will be going to be rejected. So that is one thing which you have to keep in mind. And so the thinking start before you start doing research. Don't think when you are publishing it. Think before you start doing research. Yes, sir.
Very
Thanks a
true.
lot,
Very
Dr.
true.
Chinmay.
Professor Chinmay, very, very true. The study design actually is the make or break thing. If you are going to write a paper, if you have a very poor design, and which is why 70% of the papers are rejected because of poor design. So, like the paper will never see light of the day, and it's very easy to see through a poor design.
Excellent. Dr. Praveen.
Yeah, a very good evening to everyone. Thank you, Dr. Satish sir, for wonderful presentation. A lot of insight, and every bit you were explaining is something which is very, very essential for every researcher to understand and practice. And especially the acronyms you were giving are very, very inspiring and very essential that everyone follows these simple steps to make their publications more useful. Coming to the points that I just wanted to ponder on, uh, publication, thinking about publication should start hand in hand with the designing of research, as Dr. Chinmay was absolutely he was hitting on the head. So most of the time we do the research and then think of shall I publish it or not. Always start with by keeping the end in mind. That's what is usually told about the publications. Begin with end in mind. So keep how many what would be the outcome of my research? Will I be able to publish one comprehensive paper out of this whole research I am doing, or I can have one or two splits in this? Not too much of splitting is called a salami slicing, which is absolutely unethical. So having two separate objectives which are independent of each other, can I have two publications? Considering the scope of the work, how I'm going to plan my publication. Keep this thing at the beginning and then start working on it. And I was just looking at the questions that were being asked, whether sample size has to be calculated before the study or after the study. The design has to be decided before. No, everything has to be well planned, and then we need to execute the study. And later on, the publications are outcomes of the research. They are not the research in themselves. Keep that thing in mind and then start working on it. And one final thing I want to tell, because many are the budding researchers over here who are planning for publication in future. You cannot understand or appreciate the temperature of water until you put your hand into it or put a part of your body into it. So please enter into the water. Once you enter into the water, you start experiencing its depth, its feel, and then you will enjoy its presence. So in that context, to publish, to experience the publication, start writing the papers, start enjoying that process of publication. Then only you will realize what is good and what is bad in that. Just looking at the water, I cannot make out the experience of the water. So I request everyone to start experiencing it. Then only you will realize the depth, you will realize the scope, you will be able to move further in that direction. That's all from my side. Thank you.
Thank you, Praveen sir. Very interesting observations. Like you said, I fully agree. No design, no publication. And like I was sharing with Professor Chandra before, because as a reviewer or sometimes as the editor in chief, one of the comments you write, a study design flaw is a fatal flaw. I mean, you cannot go any further beyond it. And in terms of, like jumping into the water to test the water and not wait on the bank is a very true suggestion, because unless you write your first paper, get it rejected, you never open your eyes to reality. Very, very true.
Thank you.
And
Thank
also,
you
so when
very
you're
much.
talking about, about having the sample size or whatever, the effect size or response rate, all this not being anticipated earlier, very important. That's why, in the parts acronym, when you're writing your results, A stands for assurance. And assurance, whether it's validated, it's reliable, what is the effect size, what is the sample size, everything has to be taken into account at that point. So this should be a part of the design early when you're trying to design, or else you will not be able to write your results or your observations very well. Thank you, sir.
Thank you, sir.
Thank you so much, Dr. Praveen. Thank you, Dr. Satish. I will just take up a few of the questions, about 5 or 6, which I felt were significant and to the topic. And so to start off with is one of the participants had asked, and so Lalu ma'am, are you there? I think Dr. Lalu is not there. So the first question will be to Dr. Chinmay. Now, sir, when we look at, because you had taken that study on those, actually on searching on PubMed, one of the first points which come up is into the list of quality or safety related topics and to articles is about how to get the journal. So because for a clinical topic, it's very easy to search for a journal. I find it much easier to search for that compared to a journal which is related to quality and safety. So which keywords would you suggest for people to choose? And then Satish sir already had mentioned about the scope of the journal and all that, how to choose. So if you could just brief us in about 30 seconds as to which would be the keywords, how to go about searching for a journal, so that they don't get into a journal which is not even indexed and those kind of things.
So,
because that is the first major point.
Yeah, so I request the participants to go to the PubMed, write word quality, and in large bracket write JOUR.
PubMed. Comment it again, sir. It was not clear.
Yeah. So go to PubMed, in search option, write quality in bracket, large bracket means bada bracket जो हम बोलते हैं, write JOUR. Only that much they will JOUR. Only that much they will write. They will have a list of journal which has a name having a starting with the quality, or in the title of the journal the quality word is there. So they will be easy for them to find it out.
All right, great, sir.
And
thank you.
And then if they are getting too much journal, then they can add plus AND, capital AND, and then India.
Great, sir. So if you could just put it on the chat box, sir, it will be easy for the participants. Kind of thing. All right. Thank you, sir. So the next question is about the kind of, when we initially start off with writing articles. So, Dr. Praveen, if you could just answer this, because usually it's very difficult to people to start off writing all by themselves, and usually you do get a team. You have a bunch of people you have with who are friends or your good colleagues as researchers. What are your suggestions on getting that group together as a team? Because as a team, when you start publishing papers, it works to the benefit of everyone because everybody contributes and it comes as a group. What's your option on that?
Thanks for the question. Everyone has got different set of competencies. For example, someone is very good in writing the methodological aspects. Someone is very good in putting the results together and write an interpretation. And someone is very good in English. And some person would be a reference manager. So it is always important to have a team, and the team should identify what are all the different competency sets in each person, and then start writing together. It is always important all of them should sit together and write the detailed plan and then work independently. Sometimes what happens, I had one of my friend who came and he told, I have this research and let us all write the paper out of it. And you write the literature, you write the introduction, you write the methodology, you write the results discussion, and all of us will come on one day and we'll have a discussion. And when we did it, and when we brought it together, all for our surprise, all of us had worked on the same thing, and every work was incomplete. So in that context, these people who are called as a members of the team should come sit together and write it together if possible. Otherwise, they have to chalk out the plan. This is how I'm going to write. This is how I'm going to write. And then put the plans together, be in contact with each other. Now it is very easy to have a Google form, Google, what do you call, the format being created where everyone, the word format is created and everyone is aware of what other person is writing. So in that context, it becomes easy for making the publication, writing the initial manuscript. And once it is written, everyone should sit together and read it out loudly or read it to themselves and understand each other perspectives and write it together. Some thought is there should be one master author. We call him as a corresponding author, will be overall in charge of the paper. Okay, so a draft paper can be written by him and rest will add the points to it and make it more comprehensive. It is not one particular way of writing the paper. It depends on the research team's chemistry or research team's thoughts. How they write all the things together and put the design a particular manuscript. Then of course it goes to the seniors in the panel and they will review it, give their remarks, critically appraise the paper, and then the final paper will be ready. So this is my thought about the question, and others can also ponder on. And as I mentioned, there is no one single way of doing it. It is a teamwork.
Thank you so much, Dr. Praveen. So coming to Satish sir, now carrying on with what Dr. Praveen said, and there were some questions with regards to on your presentation. Some had put on the Q&A, like how to get what will be the qualities of a good critique for the paper. And another question which is related to your presentation will be with regards to quality or safety related articles. Is the same IMRAD format, is the introduction, methodology, results, and discussion, is it the same format that's followed? Or for a QIP, does it need to be a different kind of headings or for quality related topics in those kind of journals, for example, BMJ or quality safety? So 2 questions for you.
Yeah, first let me answer the second question first. Now, it is safe to use the IMRAD format because, first of all, there's clarity of thought. And if you remember, majority of the reviewers or the editorial board members on different journals are the old schoolers who have gone through this format of IMRAD. So anything new that you stick in might not work with them. So, it's often difficult to change a pattern of your thinking. And this IMRAD has been proven for so adopt that, so it's easy. It is safe to use that. Although for descriptive studies, you don't follow the IMRAD format. You just write, it's a narration, it's very narrative, and you don't have to follow the system. But I have also seen people who seen papers where in descriptive studies you also use IMRAD. although it is toned down significantly. So I have seen that happening. So IMRAD is safe, although it's not the only way, but it's safe to do it because most reviewers and readers have plugged in their thinking in that format. And the second question, please.
That is about how to select a good critique.
Yeah. Now, selecting a good critique is very essential for every publication that you are writing, is because, so like I told you, my reference there was that this person is a wicketkeeper. So behind the stumps, he could see the pace, he could see the grass, he can see the pitch, he can see the bounce, he can see the lift, and he can also from by standing behind the stumps, he could also see the entire field. How many are in the on the yard? How many are within the 30 yards line? All this he knows because he has a global view. He has a very bird's eye view of what is happening, and it's different from a person who's writing the paper, because they could have a tunnel vision when you write the paper. It could be different from the collaborators who actually participate in the study, or they have participated in the study, and after you write the paper during a course of time, everybody walks into a mode of acceptance of, well, this is the right way to do it, right? And the critic is the one who actually shows them the mirror and says, well, there are other ways to do it also. And you find this is missing, and this is missing. And sometimes I have seen in our group here, we have papers that have been shelved because of the critical review that we get. And 9 out of 10 times that the critique is as good as the reviewer of the journal, and sometimes even in worse, because they critique so intensely. But your paper always benefits from critical review. And the best person to be on the critical good critique is somebody who is a content or subject expert, because who has gone through this many times. And for quality and patient safety, I often seen that in my experience, the accreditation experts, because they know the global standards, they know the measurables, and they also know the standards and measurables for accreditation. They tend to be very good in terms of critiquing a paper for patient safety or care quality. Thank you, Dr. Prakash, for the question.
Thank you so much, sir. So final 2 questions to the panel. One was a general question about ethical clearance for the kind of studies, although it doesn't fall into the purview of this particular topic. But then from our CAO research committee and the discussions, we had come to a conclusion that except for clinical audits and for quality improvement projects, which are other than that, anything which does a survey or a questionnaire, or you are directly interviewing patients or this thing, do need some kind of an ethical clearance and go through the committee. So bring points from the panel, and Satish sir, if you have anything else to add.
I have to just add one thing, that everybody has to now actually understand that, see, ethics committee is not like a lion, or it is not a tiger. It is not going to eat away. Actually, all are afraid of ethics committee. Now, gradually, they are also becoming sensitized. So, whatever study you want to do dealing with the human being, you have to go to ethics committee. It is a purview of ethics committee. They will tell you that no require or expedited review or full review. So, I request everyone to please go through it, because now journals are also asking your ethics committee later detail, or sometime if they are not satisfied with some of your methods, they will ask later also. So it is good to get an exemption from ethics committees themselves. And just to add one thing to what Dr. Satish sir has said regarding that critical review. So what I request everyone, that you yourself become critical reviewer. You might have heard regarding journal club. So you take a session, again go to the recorded session of Satish sir, take one article which you like the most and go through one by one. And as sir has done highlighting, you do the highlighting of that paper. So once you will review 2, 3, 4 paper, you will realize that what mistake they have done, and then you will not do that mistake. So have a group of 6 or 7 people, sit together, use acronym given by Satish sir, and try to evaluate paper by yourself. And so you are learning by others' mistakes, that you will not do the mistake in submitting the paper. Thank you.
Thank you, sir. So then if there's a last final question I think there was a good question which came. So based on the extensive experience all three of you have had, what are the what have been the commonest reasons for an article or a submission being rejected?
I think, Dr. Pratish, I can answer that because in my career, for the last so many years, I think 95% of the papers that were rejected is because of the design, poor design. And although in some parts, and the other maybe 3% was because, there is a lot of speculation. When you have data, you don't really place your data in your results. You try to speculate because this happened, maybe because of this and this and this. If you don't have the data, don't talk about it. Limit yourself to the data only. That's the other 3% of rejection. And 2% of other 2% of rejections happen because of a very poor structure of your paper. It's all over the place and it's not readable. But I don't think I have ever, thanks to my mentors, I have rejected a paper because it is from an international researcher and they are not very high on language. I have not rejected a paper. The reason being because initially, when I was a member of the International Journal for the International Council of Medical Journal Editors, it was always shared with us. There are pedestrian errors, which we call as punctuation marks, grammars, things like that. If the study is good, structure is good, science is good, you will have to, as an editor or a chief reviewer, to make sure you turn a blind eye towards this, because that will be taken care of during the editing and the copy editing phase anyways.
Right, sir. Dr. Chinmay, sir?
And just to add what Satish said, that when you're submitting in your article, you just see that you are putting to the proper journal. If my study is of Gujarat only, and I will try to submit it to international journal, it is going to be rejected because that is not the scope of journal. As Satish rightly mentioned, that when you are submitting, look at the scope, what you are going to declare at the end of your research. So look at that. So many of the rejection can be avoided only looking at this.
Praveen, sir?
Yes.
They have added most of the things. They have already mentioned most of the things. Just to add one or two things from my end, having clarity of thoughts in the paper. For example, when you write a paper, read the paper as a reader. Okay, so if the reader can understand the paper, the heart of your study or your manuscript, then you have passed as a author. Second thing is, try to give as much information as possible in the paper. That will avoid rejection. Having conjugacy in giving the information, keeping this will go into my next paper, that will definitely reject the paper. And the third thing is that replying to the reviewer should be a very polite way of replying to the reviewer. For example, reviewers may not be experts in the area, or sometimes they may not be well aware of the recent advances, as Satish sir was making a mention. So in that context, it is better to be very polite with the reviewer, so that it will be you will be answering to their questions in a more softer way. And most important thing is link. There should be a proper link between your title, your objectives, your methodology, and your results, and all of them should be well aligned. You say something in introduction, you make some great hypothesis saying that I'm going to change the world, and your results are very descriptive and very simple, and nothing to align with the objectives of the study, then definitely the paper will get rejected. And always don't think of having very high-fi statistics when you are presenting the paper. So whatever is essential, do that much of analysis and present your paper, just for the sake that if I have a very good p-value, my all results are statistically significant, and I use all hi-fi multivariate regression and all. If you feel that your paper will get accepted without having much stuff into it, then you are not actually thinking in a right way. So do the analysis in the way it is mandated, it is required. Let it be a very simple descriptive analysis. If it is appealing, then the rate of acceptance is going to be more. So keep those things in the mind while you are structuring the paper to avoid the rejections. Thank you.
Thank you so much, Praveen sir and Chinmay sir. So the take-home message to all the participants is writing the research article and getting it published is the last step of the research process. So your entire planning the research and how you go about doing the research the correct way, where everything, all this about sample size, the study design, ethical clearance, what kind of everything comes much ahead, involving the statistician, forming the team, and roles and responsibilities clear. All that comes towards the end. So thank you so much, Dr. Chinmay and Dr. Praveen. So Satish sir, any final thoughts from you before we wrap up?
Yeah, just one thing. I saw one of the comments was, what is the sandbag effect? A sandbag effect. Yeah. A sandbag effect is when, knowing that, Dr. Pratish, Dr. Praveen and Chinmay sir and everybody and their families could be potential reviewers for my paper. I anticipate that when I'm writing the paper. And I make sure everything that you have published, everything Chinmay sir has published or Praveen sir has published, I list them in the references. And so my introduction and my discussion goes like pages and pages. So what happens is this keeps a barrier, creates a huge barrier between the reader and the reviewer, between the reader and your paper and the reviewer. So the distance is too much, and then people lose interest. The flow is lost, and then the paper is not worth reading anymore, or it's not interesting anymore. That is called the sandbag effect. Okay, so that is one thing I wanted to say, and so because somebody has a question. Anyway, thanks to Dr. Praveen sir, and also Chinmay sir. I enjoyed the discussions as always, and thank you, Dr. Pratish, as always, being a great moderator and doing it so beautifully. And like I said, I trust that all the participants benefit significantly from this. And if there is anything I can answer questions or it can be of help, please let me know.